So welcoming refugees, this is something that we've heard a lot especially in the last few months. What does it mean to welcome people? And more importantly, what does it involve? So first of all, who are we welcoming in Scotland? Most people arrive in Scotland through the dispersal route, so people have made their way to the UK and are they applying for asylum in Croydon in London and are dispersed to Scotland. And at the moment, most people are in Glasgow, and it's around 3,000 people being supported by the Home Office currently in Glasgow. The resettlement route, I will not go over it because Maureen has given us a really comprehensive presentation on this. We also have children arriving on their own. The numbers changes every year, so they are people who are especially vulnerable here in Scotland. Family reunion, once people have refugee status here in Scotland or in the UK, they have a right to bring their family over. Close relatives only, so their own children or their spouses, maybe some of the Syrian refugees who you work with will be bringing some of their family over as well. It's a very diverse population. In the media, we've heard a lot, and sometimes only, about the Syrian refugees arriving. In Glasgow, here are the top 5 nationalities. These data are a little bit old now because it's from our holistic integration service of last year. The data for this year are not yet available because the year is not over. So here are the top 5 nationalities, and of course Syrians are here. So they are Syrians who've made their way here on their own to the UK. They've not been resettled. Gender, a vast majority of men, simply because it's a dangerous journey. So single men will be most likely to come, and they will be aged between 20 to 35 years old. So a very young and active population, people who really, Maureen talked about building a new life. These are young people, starting their lives. Being single in Scotland doesn't mean people don't have a family. It doesn't mean they're not married, they're just single here. So again, the family composition of people may change a lot. And at the age, you can't see it, but there are the data around the age group, and it's mostly between 20 and 35 years old. We're here to talk about language, to talk mostly about learning English, but I wanted to highlight what people are bringing. These are 3 of the 5 top languages of the future, according to the British Council. So refugees who come to Scotland are bringing 3 out of those 5 languages. So people come here with a strong potential. The Syrian refugees who you will help, yes, you're going to teach them English, but they're bringing Arabic language, which is a more and more wanted language in terms of business and employment in Scotland. So it's important to remember that. So that's the graph. So apologies for that. It's a graph that we will share the presentation so you will be able to see it. It's a graph as well taken from our evaluation report of the Holistic Integration Service last year. The key message is that, let me check the number, 64% of new refugees last year were access to in English. A lot of them as well have literacy issue. So the teaching of English is very much about beginner's level and really supporting people to navigate, that support people for orientation, accessing services, making sense of things, and it's about starting from the beginning. So that's the beginning about how we've started welcoming refugees and looking at integration. So you've seen that diagram already. When you work on refugee integration issue, you will see that diagram almost once or twice a week, especially in Scotland. This is a diagram developed by Dr. Ager and Strang back in 2004. They were both commissioned by the Home Office to understand what makes integration, what supports people to integrate. So that's a series of indicators, which is what I call what you need in life. You know, wherever you come from, that's what you will need. That research led to the first pilot programme commissioned by the Home Office, Sunrise. Sunrise is an acronym, and please don't ask me to tell you what it means. The most important is to remember that it's a pilot which tested the model of a case owner, so an integration advisor who would support the person around the different areas of life and work with partners, expert agencies for things like employment or language. And that ran over 3 years throughout the UK, and Scottish Refugee Council delivered the pilot for Scotland. Then, after the learning from Sunrise, the Home Office commissioned another integration service, which is the Refugee Integration and Employment Service. And the focus was very much on employment. It was about getting people into work, which is a very valid point, but it kind of ignored the other things that people needed before being able to do that. And it ignored the health issue, it ignored the pre-employability issues around housing and access to benefits. Language wasn't really there. In 2011, the Home Office stopped any integration service. So the RACE programme that I've just mentioned was funded by the Home Office throughout the UK, and in 2011 it simply stopped. Here in Scotland, we've been fortunate to work with the Big Lottery and to receive funding for holistic integration service. And we were really keen to go back to the Ager and Strang model, to try to look at how we could actually support people holistically. And holistically is a buzzword. Yes, we're going to help people about everything. It's a challenge and it means working in partnership. So the Holistic Integration Service is a partnership with Scottish Refugee Council, 2 ESOL providers, which are WEA Scotland and Glasgow Clyde College, an employability agency, which is Bridges Programmes, and the British Red Cross, who provides more of an enhanced support to people who are facing more complex situation. Here are the official aims of our service, and it's overall about access to services. But what I find it more, something that illustrates a little bit more what we're trying to do, is to help people to make sense of this. We're in this, and we're all responsible for confusing people. You will probably find a logo that relates to your work that you find familiar. We've added on here, yes, the train station logo, because that's even something we need to explain to people when we show a map. So it's really, this is what it means to welcome people. It means making sense of an environment that we may find completely normal, that we are very familiar about, but people who are just arriving here have no idea about what those signs mean, even less about what the roles of the organisations are. So, thinking of people with refugee status and Syrian refugees, something like the Job Centre Plus is really complicated to get your head around when you come from a country where there's no welfare system. Another one is the NHS. Even if you work with EU migrants, even for EU migrants is very an unusual concept, this NHS that deals with everything around health is here in the UK. So how does it work? It's important to explain this to people. Here is a quote which confirms how confusing the situation can be, but also which highlights the conflicting priorities that people have. Syrian refugees, when they arrive, they will have the first week appointment for biometric resident permit to the job centre. They will be shown their house and everything. People who go through the asylum process will not receive as much support and will have to make sense of this on their own. They will face most often destitution because the benefit payment don't come soon enough, and 95% of them will present homeless at the Glasgow City Council services. So when you've got the choice between I need a home tonight, or I need to make sure I have money but also have my ESOL class to attend, flexibility needs to happen, and it's often the flexibility needs to come from the ESOL providers. Here are the principles of our holistic integration service. It's all about making sure that people know their rights and options, but more importantly, that they know how to exercise them. Early intervention and prevention, another buzzword, but that means working with people as soon as possible once they get refugee status, so we can start that work of what is a job centre, what is homelessness, what are people's rights in those systems. Recognition of vulnerability and resilience, it's one that we had countless discussion as practitioners amongst the partnership. Yes, people have lived horrendous experience that none of us in this room wish, would even imagine. But people are bringing a lot here. They've made it here and they want to build a new life. So it's our responsibility to recognise what they bring, where their strengths lie, and that we encourage them to manage things on their own, and we don't hold people's hand. None of us here would want to have our hand hold every time. We're adults, we're people, and we all believe we can do things by themselves. So do refugees, whether they come from Syria through the resettlement project or people through the asylum route. So yes, let's not ignore the difficult situation that people have faced and how difficult things are here as well for people, because going through homelessness and destitution is not easy and will create vulnerability, but people also have the strength to support themselves if they have the right support. Sustainability. It's not about sustainability of our service, it's about looking at the sustainability of the outcome that we manage to achieve for people. So in terms of ESOL, it's very much about what do people need to learn to manage things on their own. What kind of terminology is used by the job centre? What kind of terminology is used by housing provider? I used to work in housing, and that's a different language altogether. The housing workers will talk about apartment instead of bedroom. It confuses everybody, but these are small tips that people need to know. So thinking long term, what do people need to know to manage as much as possible on their own? And the partnership. The partnership is the only way we can actually provide a holistic service. No organisation knows how to do everything. We all bring different expertise, and it's important to bring it together. So who does what in our partnership? So this is just briefly, Scottish Refugee Council has integration advisors who will support people to develop a personal integration plan. So what are people's goals in terms of their housing, their education, their language learning, their employment expectations and ambitions, and more importantly as well, what do people need to feel connected in Scotland? So looking at social connections as well. From that, we will make referrals to our partners on language, employability, or with the British Red Cross. Here's is a really, really simple diagram about the integration plan. Language is at the core. WEA Scotland offers a language assessment to everybody who will access the service, and that turned out to be a real gateway to everything else. From the language level, we are able to refer to appropriate employability service. Some employability service will only work with people from Access 3 level, simply because this is what employers need. the ability to understand basic instruction, the ability to understand health and safety instruction, and so on. Health, housing and welfare are key pre-employability activities as well, but is really the core of building a new life here, feeling secure in your home. And this is something that Syrian refugees benefit from as soon as they arrive, and that's a really strong advantage. And as Maureen mentioned, housing is not about everything, but it's the core, and from housing then the other areas of integration can be looked at. And of course education as well, but depending on language level, the goals will be different. It's probably a good time to talk about what WEA Scotland does on behalf of Craig, who's unwell today. So I can't replace his full presentation, but just to give you a little bit of information about what they've been doing in the partnership. WEA Scotland has worked with people who were Access 2 or Access 3 in English, many of whom had as well literacy issues. They provided a 40-hour survival English course, so it's very short, and we had hoped it would be longer, but it was due to funding. The survival English course was developed really based on what are the other areas of integration and what will people need, what will people engage, and who will people engage with. The course has very much been adapted based on feedback from learners and feedback from other practitioners in the partnership. The course involved a lot of visits to museum, visits to loads of different places to create an opportunity to talk. Visits practicing going somewhere, buying a bus ticket and make it to the right place. Simple things, but that are really, good tools. That method has been greatly appreciated by learners in Queen Margaret University, who's the partner I've not mentioned yet, but they've been a key partner. They've been our evaluator, external evaluator from the beginning of the service. And so they've had focus groups and interviews with people who've accessed English provision through WEA. And this teaching, this combination of classroom teaching and social practice seems to be something that people really value. WEA Scotland has done, when I talked earlier about conflicting priority, there's been a lot of changes that had to happen about how the classes were delivered to enable people to come to the class but manage the appointment at the Hamishland Centre, which is a 24/7 centre in Glasgow to present homeless and be provided with temporary accommodation. Managing as well engagement with the job centre, because people would bring their workbook and say, what do I write on this? What can I write? So class, in the class they've actually talked about how to fill up the workbook, what is a meaningful activity. Coming to the class is a meaningful activity, so it's important for people to report that back to their work coach. So tutors have found themselves having to learn about job centre processes, and we ran throughout the service a community of practice, which are basically meetings for all practitioners involved in the partnership, and that led to incredible information sharing and expertise sharing. So people from Bridges programmes and Scottish Refugee Council would support ESOL Tutor to respond to those inquiries from learners. I've got the job centre this afternoon, what can I tell them? You will see people being quite anxious about this, so it's important to have a way to support them like this as well. So I think this is, hello? Yeah. I think this is mostly what I wanted to say about the input by WEA Scotland. There's been a lot of learning, and even their involvement and the involvement of Glasgow Clyde College has been of great benefit of our advisors about how we do our advice work and how we support people in their integration overall. So here are all the partners involved. So SRC's got an experience now of 10 years of doing integration work. We truly believe that the holistic approach is the one to go for. Our service, however, the funding is coming to an end, so we are at the moment looking for further funding. We have been involved as well in Client Bank with Western Bartonshire Council with Syrian refugees there, and we provided an advice service, and a peer mentor as well is working there to continue to promote integration and supporting people in that direction. So there's been a lot of learning. I'm going to be here until lunch. I'm not saying we have all the answers, but we're happy to share what we've found out so far, and I'm very looking forward to have more discussion with you if you think that'd be helpful. And I've got my, contact. First of all, I wanted to mention this is a link to our Year 2 evaluation report. So with loads of quantitative data that maybe is not relevant to everybody here, but there's a lot of information around language learning and how people are perceiving there's language learning mixed, and the impact on social connection, which I think is really, really important, how much ESOL has a positive impact in supporting people and building social connections.